Okay, so we have a patient visiting today and has done well, but has noticed that maybe with some ice cream, a little bit of upset stomach. And so I want to talk about lactose, the milk sugar. I'd like to talk about dairy products, and I'd like to talk about the enzyme that we are fitted with so that we can digest lactose, called lactase. When we're babies, most babies can digest lactose, the milk sugar, because it's what's in breast milk. And so it turns out that the enzymes in babies to digest milk sugar is good. Now there are some babies who are actually lactose intolerant, and that's a problem, but most babies can digest milk sugar pretty well. Now it turns out as we age, as we get to teenager and older, the enzyme in our gut that digests lactose, the lactase enzyme, declines in lots of people. And there are different genetic groups, Mediterranean, African American, others, that have more of a drop in that enzyme than others. But if you just look at adults in general, we don't drink nearly as much milk as kids. And the reason is because of that drop in lactase. Now, it's interesting that the lactase enzyme is in the upper small intestine. That's where God put it. And when we bypass that upper gut. So many of our patients, either sooner or later, will develop intolerance to the lactose sugar. And intolerance shows up as cramps, abdominal pain, bloating, nausea, and things like that. So you have a couple of options. One, you can choose to have food that doesn't have lactose in it. So like lactose-free milk, lactose-free this, lactose-free that. Two, you can choose to have a food that has a little bit of lactose in it and add your own enzyme, which you can buy in the grocery store, and it's called Lactaid. So you say, I want to have ice cream tonight. I'll pop 2 Lactaid tablets with it so I can enjoy that without the cramps. The third thing that you can do is you can actually eat yogurt, which has the lactose in it, but has the bugs in it that help digest it. So most people can do well with that. If you don't, we have had people have devastating problems with lactose. Severe cramping pain, be evaluated by their doctor, been told they have to have the surgery reversed because they kept eating lactose, kept having pain, kept having diarrhea, and kept getting sicker just because they're eating the wrong thing. So be careful out there, lactose can be a problem.